Well, my research focus currently is on military and family health and caregiver burden. I look at healthcare across the spectrum as it relates to military, active duty families, and the military members themselves. And then I look at veteran healthcare to see what works and what doesn't work. I've been doing this for over 20 years. I have a special interest in it because I'm a retired Navy captain. And when I was on active duty, we started looking at the wars of Afghanistan and Iraq, lessons learned that we could do better care in the field at war, and then as we moved the wounded soldiers and sailors and Marines back to the United States, how we could better educate and train the medical workforce to address their new injuries. So I've been fortunate enough to have a long program of research that's been funded by the Tri-Service Nursing Research Program, which is the Department of Defense's equivalent of the National Institute of Nursing Research. They've funded several studies of mine. One was diabetes case management, looking at the military healthcare needs of patients and people who live with diabetes, comparing them to the civilian sector. I was fortunate enough to have a clinical knowledge study that looked at what are the needs and learning needs of nurses and other healthcare providers who go to war to care for wounded, ill, and injured service members. And then we had a follow-on study that looked at the wounded care journey of the service members themselves. We have had several education grants to diffuse evidence-based practice in the military healthcare system. My current project and future projects is to expand what we know about caregiving and what we need to know more about, because the issue that I work, or the area that I research, is caregiving or burden of care in younger caregivers who are caring for service members who are wounded in the wars in Afghanistan and Iraq, and also other service members who have been afflicted with cancer and other problems. Because this group of subjects are much younger, and they're not, the needs and problems and issues that they have are different than what we know from the literature about older adult caregivers and we traditionally know about their caregiving. And for one example is older adults who have had healthy relationships use the memories of their relationship in their past experiences to sustain them in their stressful caregiving work, whereas younger caregivers grieve for the future and the dreams that they had hoped to come to fruition, but have been interfered with by their injuries from war, either the husband or the wife or the spouse of the person who came back from Afghanistan and Iraq is not the person that they originally had a relationship with or married. And so the person is different and the relationship is different, and some of them are severely injured. And so they grieve for the memories that they hope they would have versus the memories that they do have. So I would like to further explore that so I can help policy makers address, these special cohort of needs, as well as prepare the workforce for the future to teach and educate healthcare professionals to care for this special population, because they're healthy despite their injuries and will be in the civilian healthcare system for the next 30 to 50 years, as we know that most individuals from the military who retire or who are veterans receive their health care from the civilian healthcare sector, not the Veterans Administration and the Department of Defense healthcare system.